Welcome to our presentation on sleep disorders. Sleep plays a fundamental role in our health and quality of life, yet many individuals struggle with various sleep-related issues. In this comprehensive guide, we will explore the wide range of sleep disorders, examining their causes and the most effective treatment options available. Whether you're a medical professional or a student, this presentation aims to provide valuable insights into understanding and managing sleep disorders for improved patient care and well-being. Let's dive in. Restless leg syndrome, RLS, also known as Willis-Ekbom disease, presents a neurological challenge characterized by an intense urge to move the legs, often occurring during periods of rest or inactivity, particularly in the evening and nighttime hours. This disruptive condition profoundly impacts both sleep quality and daily functioning. The underlying cause of RLS involves a depletion of dopamine in the basal ganglia of the brain, resulting in involuntary leg movements and spasms. Managing RLS typically involves a combination of lifestyle modifications, including improvements in sleep hygiene, regular exercise, and smoking cessation, alongside pharmacological interventions such as dopamine agonists and carbidopa-levodopa. Understanding the neurological mechanisms behind RLS is crucial for effective diagnosis and treatment, ultimately improving the quality of life for individuals affected by this challenging disorder. Periodic limb movement disorder, PLMD, also known as nocturnal myoclonus, presents a distinct sleep disorder characterized by involuntary and unconscious movements of the limbs, particularly during sleep stages. Unlike restless leg syndrome, which can manifest at any time, PLMD exclusively affects sleep, leading to significant daytime sleepiness and impairment. Symptoms of PLMD include involuntary limb movements during sleep, often leading to fragmented sleep patterns and excessive daytime sleepiness. Diagnosis typically involves polysomnography or a sleep study to detect and quantify limb movements during sleep stages. Treatment options for PLMD aim to alleviate symptoms and improve sleep quality. Pharmacological interventions may include dopamine agonists, carbidopa-levodopa, and anti-Parkinson's medications to address underlying neurological imbalances. Additionally, lifestyle modifications such as limiting alcohol, caffeine, and stimulant consumption alongside a trial of clonazepam therapy may be beneficial in managing PLMD symptoms effectively. Insomnia, a prevalent sleep disorder, manifests as difficulty initiating or maintaining sleep, often resulting in significant impairment of daytime functioning. Effective management of insomnia hinges on understanding and addressing the factors that influence sleep hygiene. Symptoms of insomnia include persistent difficulty falling or staying asleep, occurring at least 3 nights a week and leading to impaired daytime functioning. Various factors contribute to insomnia, including disruptions in sleep hygiene such as irregular sleep schedules, excessive caffeine and alcohol consumption, and underlying stress or anxiety. Treatment strategies for insomnia encompass both behavioral and pharmacological interventions. Behavioral interventions focus on modulating sleep hygiene factors, including establishing fixed bedtimes, limiting caffeine and alcohol intake, and managing stress. Pharmacological options may include medications like trazodone, Z-drugs, zolpidem, esopiclone, zaleplon, and zopiclone, or benzodiazepines, such as lorazepam, to facilitate sleep initiation and maintenance. Jet lag, a common experience for frequent travelers, occurs when our circadian rhythms struggle to adjust to a new time zone, resulting in disruptions to our sleep-wake cycle. These disruptions can manifest as feelings of drowsiness during the day or difficulty sleeping at night, impacting overall well-being and functioning. Circadian rhythm, disruption, traveling to a new time zone confuses the body's internal clock, which remains synchronized with the original time zone. This misalignment between internal and external cues leads to the symptoms of jet lag. Melatonin therapy. Planned melatonin therapy can aid in resynchronizing the body's circadian rhythm with the new time zone. Melatonin supplements, taken at specific times according to the destination's local time, help regulate sleep-wake patterns and mitigate the effects of jet lag. Lifestyle adjustments. In addition to melatonin therapy, making lifestyle adjustments can further alleviate jet lag symptoms. Avoiding alcohol and stimulants like caffeine, which can disrupt sleep patterns, is recommended. Increasing exposure to natural sunlight during daylight hours can also help reset the body's internal clock, promoting quicker adaptation to the new time zone. Narcolepsy is a sleep-wake disorder characterized by uncontrollable episodes of daytime sleepiness, often accompanied by sudden muscle weakness known as cataplexy. This condition results from a deficiency in the neuropeptide orexin, which plays a crucial role in regulating wakefulness and arousal. Symptoms. Narcolepsy presents with extreme daytime sleepiness, which can lead to unintended sleep episodes during daily activities. Cataplexy, characterized by sudden muscle weakness triggered by emotions like laughter or surprise, is another hallmark symptom. Causes. Narcolepsy is associated with low levels of orexin, a neurotransmitter that helps regulate sleep-wake cycles and maintain arousal. The exact cause of orexin deficiency in narcolepsy is not fully understood, but is believed to involve autoimmune or genetic factors. Diagnosis. Diagnosis of narcolepsy typically involves a combination of clinical evaluation and specialized tests. Polysomnography, a sleep study that monitors brain activity, and measuring orexin levels in the cerebrospinal fluid are key diagnostic tools. Treatment. Management of narcolepsy aims to improve wakefulness and reduce excessive daytime sleepiness. Stimulant medications like amphetamine, methylphenidate, and modafinil are commonly prescribed to enhance alertness and attention. Non-stimulant medications such as atomoxetine and venlafaxine may also be used to address symptoms of narcolepsy. Additionally, lifestyle modifications, such as scheduled naps and maintaining a regular sleep schedule, can help manage symptoms and improve quality of life for individuals with narcolepsy. Night terrors, also known as sleep terrors, are a sleep disorder that primarily affects children during the deep, slow-wave stages of non-REM sleep. These episodes are characterized by sudden arousal from sleep, accompanied by intense fear and autonomic symptoms such as rapid heart rate, rapid breathing, and profuse sweating. NREM sleep. Night terrors typically occur during stages 3 or 4 of non-REM, NREM sleep, which are the deepest stages of sleep characterized by slow brain waves. Unlike nightmares, which occur during REM sleep and involve vivid dreams, night terrors often lack a clear narrative or memory. Autonomic symptoms. Individuals experiencing night terrors may exhibit various autonomic symptoms, including tachycardia, rapid heart rate, tachypnea, rapid breathing, and diaphoresis, profuse sweating. These physiological responses contribute to the intense arousal and distress associated with night terrors. Benign nature. Night terrors are generally considered benign and self-limiting, with most episodes resolving on their own without medical intervention. Although night terrors can be distressing for both the individual experiencing them and their caregivers, they typically do not result in any harm and are not associated with underlying psychiatric or neurological disorders. Understanding the underlying factors contributing to night terrors, such as disrupted sleep patterns or stress, can help in managing and reducing the frequency of episodes. Implementing strategies to promote healthy sleep hygiene and creating a calm and comforting sleep environment may also be beneficial in minimizing the occurrence of night terrors. Brain death, the irreversible cessation of all brain function, is a critical concept in the field of sleep medicine and broader medical practice. Determining brain death involves a comprehensive assessment of neurological function to confirm the irreversible loss of brain activity. Key parameters for diagnosis. 1. Persistent irreversible coma. Patients must demonstrate a persistent and irreversible loss of consciousness with no signs of arousal or response to stimuli. 2. Absence of brainstem reflexes. Essential brainstem reflexes, including pupillary, corneal, oculocephalic, doll's eyes, oculovestibular, caloric, and gag reflexes, should be absent. The absence of these reflexes indicates complete brainstem dysfunction. 3. Apnea test. A controlled apnea test is conducted to assess the absence of spontaneous breathing. During this test, the patient is temporarily disconnected from mechanical ventilation to observe if they exhibit any respiratory effort. The absence of breathing indicates respiratory failure and supports the diagnosis of brain death. 4. Confirmatory tests. Additional tests, such as electroencephalogram, EEG, and cerebral angiography, may be performed to confirm the absence of brain activity and rule out any confounding factors. Clinical assessment considerations. It is essential to conduct these assessments meticulously and in accordance with established guidelines to ensure accurate diagnosis. Confounding factors such as hypothermia, drug intoxication, or severe metabolic disturbances must be excluded to avoid misdiagnosis. Ethical and legal implications. Determining brain death has significant ethical and legal implications, particularly regarding organ donation and end-of-life care decisions. Medical professionals must adhere to established protocols and guidelines while respecting the dignity and autonomy of the patient and their family. Understanding the criteria and process for diagnosing brain death is essential for healthcare providers involved in critical care and end-of-life care decisions, facilitating compassionate and informed patient care.